So now I have the honor of introducing some of the people that I have so much respect for the way you address youth mental health in a way where the youth there's a shared partnership, leadership, youth voice. And how many of you have heard of the allcove Center?
All right.
Look at that. Yeah. So this is a concept that you're going to learn about in just a few minutes. And I want to say that our dream and our desire is to have allcove centers in every county, especially where we are here now with people from Monterey, Marin, San Luis Obispo. Where are the other counties? Yell them out. Shasta, Santa Clara, Santa Cruz, San Benito. Yeah, looks at all these different counties. So we're going to hear about that. So it is my pleasure to introduce Dr. Steve Adelsheim. Give me your names here. Koa Nathan Nhu. Help me.
Kwa Nathan Ngo.
Say that again, please.
Kwa Nathan Ngo.
Good. Thank you, Kwa Nathan. Love it. Yeah. Okay. And then Julia Ransom. Nice to have you here. And Lilia Soto is one of our adults here too. And then Vicki Harrison. And these are all from Stanford and have really some great ideas about integrated ways to support youth. So take it away, team. Let's go.
Thank you, Lori. Hi, everyone. Thanks so much for being here. Really excited to share this model with you. So we're going to divvy it up with our team. And I just want you to remember two things from yesterday that really stood out to me because I'm really excited. And what AIM does really well is take research and try to put it into action. So I'm hoping that this model of allcove is one of the action steps that you will consider. And two of the research points that the young people shared from their research yesterday was how almost, I think it was 45 to 72% of young people would not go to a parent or a counselor or a school staff person for help. And having to tell parents about accessing mental health was one of the biggest barriers. So allcove is a model that's trying to address two of those barriers. So just keep that in mind because it kind of brings your research into something that we can do as a next step. So I am going to pass it off to our director, Dr. Adelsheim, to start us off.
Oh, all right. Are you going to run the slides from there?
No, you go.
Hey, good morning, everybody. It's great to be here. Thank you, Lori and Susan, for allowing us to join you all today. I'm Steve. I'm just going to share a few thoughts about our center and why and how we started move towards the development of this model. And then what's most important is that you hear from our guides and our young people who have really driven this model through our partnership. We're with the Center for Youth Mental Health and Wellbeing at Stanford, and we do a number of different programs related to youth mental health support, median mental health issues, a lot of focused work around suicide prevention. We work with tribal and indigenous communities throughout the state and the nation, and early psychosis-related work. And we're grateful to be here. I wanted to just quickly set the stage for how we came to the development of this model. And you all are very familiar with this data. Half of all mental illnesses having their onset by the age of 14, 3/4 by the age of 24. We heard from our colleagues once again this morning about 1 in 5 young people having a mental health issue before the age of 18. And the reality, though, is that 79% of those 1 in 5 have been unable to access mental health care, right? And so we have really been focused on what that's about and trying to find ways to build service, because if you really acknowledge that half of all mental health issues start by the age of 14, well, where are all the services for those young people that are 14 who are starting to develop these symptoms of these mental health challenges? We don't have them in this country. And we're watching other countries develop them, and we became really interested in how do we build that support within our own country as well. So, things people talk about this mental health crisis we have now after the pandemic, but for all of you and those of us working in youth mental health, we all know we had a mental health crisis way before this pandemic. And we know that the services were not available before, and things have just become more complex. And you can look at this data from Mental Health America and see the increasing numbers of young people continuing to face mental health challenges and the issues that they're having around depression, around ongoing issues to access to care. People got really freaked out by the CDC report that came out in the last month because it was like, oh my gosh, our young people in middle and high schools continue to have increasing rates, particularly our young girls and our LGBTQ plus community are really facing even more challenges in terms of access, in terms of support, in terms of issues of depression, suicide risk, anxiety disorders. And these are numbers that have been there that we're just continuing to see an increase. And of course, where are all of our youth mental health providers? Well, we don't have them, right? And so for you young people, we have great career for you in youth mental health. And one of our responsibilities are to help build a workforce and find ways that you can take this on without having to take on all these extra loans and extra years in school. And we in the National Council and other partners have a responsibility to be addressing that issue. Because at the end of the day, this is the issue. We don't have enough treatment. And this is actually from one of our colleagues in Australia, where they've continued to struggle with this issue as well. So we've been grateful to see some changes on a state and national level. And I don't know how many of you are familiar with the Children and Youth Behavioral Health Initiative happening across California. They put an amazing amount of dollars on the table for one time for a 5-year period for child and adolescent mental health care. And it's kind of amazing. And as much as we continue to struggle, California has so much more resource for mental health than any other state in the nation, frankly, by a lot. And so part of the issue is how do we build out that access and take advantage of it and increase the focus for our young people on access and care. And you can see these other federal initiatives. You'll see the Surgeon General talking about this issue. It even made it to, the State of the Union address for the first time by President Biden, which was kind of amazing just to even see the discussion happening there as well. And one of the things we're going to come back and talk about is on that first line, or the second line in the first part, that $447 million for evidence-based practices. I'm going to give you a heads up now as we talk about allcove. There's going to be an RFP or a proposal coming out in the next month for people to apply for state funding out of that pot to be developing this model in your county, in your community, and within your partnership as well. So keep an eye out for that. It's round 4 of the Child and Youth Behavioral Health Initiative funding that's going to be coming out soon. I will tell you that I am a reformed, school mental health program director. I was in New Mexico for 28 years. I worked in school-based health centers for 16 of those. And as Vicki was mentioning, part of the issue for me after 16 years in school mental health was great. We needed early intervention. And it wasn't enough because of all the young people who were worried about would the conversations get to their families or would it be part of their school record or did they want their school counselor who they talked about their mental health issue writing their letter for college applications. And then summers happened and principals changed and priorities changed within schools. So it felt important to go out and look for other ways of getting early mental health support in addition to schools, because the school piece is critical. And we went out and learned about other models happening internationally. Headspace, not the meditation app, but programs for young people 12 to 25 for early mental health care in Australia. Half the population of California, now with 150 centers across the country for young people to come in for early mental health care. Our colleagues in British Columbia, about to start 30 Foundry integrated youth mental health programs. Jigsaw in Ireland, 15 sites. All of these folks have been guiding us in terms of looking at how do we build this same model here within the United States. And so We've been really trying to build this early intervention continuum of youth mental health support, from school mental health to these allcove integrated youth mental health centers, to the state and national prioritization of early psychosis programs, which we're also involved in supporting, as ways that we have multiple points for young people to come in for early care. And so we've been trying to sort of support that broad early intervention continuum so young people 14 have a place to go that feels comfortable, that's been developed by and for young people. The core aspects of the model as we've been developing it have, these 6 core areas: early mental health care, primary care support, supported education and employment, early intervention for substance use, and peer and family support. And the peer support specialists are critical partners in providing the welcoming place for young people to come in. All of this developed with youth advisory groups and a very active youth voice, which you'll hear more about. And so basically, this has been sort of the core components of our model that really have been involved in the core service delivery, integrated care, because many young people often feel more comfortable going to a primary care provider first, and then after the second or third visit, getting to the underlying mental health issue. And then we walk across the hall to the mental health support provider as well. And we've been doing all of this with an eye towards informed consent and confidentiality and ensuring that that's there, looking at good evaluation, ensuring we have a learning community that links all the programs doing this work. And right now we're starting 5 of these centers, or of open 2, are opening 3 more across the state in partnership with the State Mental Health Services Commission. And then these dollars are going to come out to hopefully open 5 or 7 more around the state, hopefully over the next, year or 2. So what we wanted to do was have you be sure to hear from our young people about what this has been like, what their role has been, and why they think this model is particularly important. So at that, I'm going to hand things off to Anna Lilia to talk about sort of the youth vision and involvement.
Thank you, Steve. Hi, hola, buenas tardes. Ana Lilia Soto, and I get the awesome honor of working with our young people. But before we get into that, I want to talk a little bit about what really makes this model unique. And so, like Steve shared, we are prevention and early intervention focused. We want to support that continuum of young people who sometimes have shared with us that their problems weren't enough to warrant support. And one of the things that we always share with allcove is, if you want to talk about it, that's reason enough. It's a youth active advisory board, it's youth-centered, it's youth-informed, so everything from those core services, one of the key things that we ask our young people are like, what else do we need? We have those really cool 6 service streams, the physical health, the mental health, peer support, family support, substance use. What else do young people need to see? Which is why it's really crucial that that youth advisory group is connected to the community. They know their communities, they know their populations, and they're able to share, you know what? We want an art class, but don't label it art therapy. We want puppies. We want a venting room. That's the best one that I've heard so far. We want just different things that we get to do, because what happens with allcove, and one of the best things, is that all of the pathways do lead to mental health. We want stigma-free, and we want an opportunity to normalize mental health. So one of the key roles that the youth advisors do is we go out into the community. We make sure that we're addressing some of those challenges and create healthy dialogue. We know it's not going to happen overnight, but we're definitely planting those seeds. Youth-friendly and engaging and upbeat staff, like me. So we want young people, this is why our young people are involved in the hiring. We want to make sure that the folks that are working, from the clinicians to the doctors to the peer supports, have talked to our youth advisors. We know we're doing things a little differently, so we want to make sure that we have staff that are going to be able to meet those needs and wants of allcove. Again, strong youth outreach and marketing. We have a consortium of youth-serving agencies. We see ourselves not as the end-all, be-all, but let's bring everybody together as a hub for all of these organizations that are already doing some amazing work, but let's not make it hard for our young people to get to. Let's bring them together. Integrated care, like Dr. Adelsheim shared, and then a really trusted co-design brand. So we want to make sure that One day there's going to be an allcove Monterey, and your young person might go to school somewhere in Palo Alto, in San Jose, and there's an allcove there, and they're going to recognize the allcove and say, you know what? I know I can go there for services. I know how I'm going to be treated, and I know that they're going to focus on me as a young person first before all of the other stuff gets involved. So before we started allcove, so back in 2018 when I organized our first youth advisory group, we didn't have a name, we didn't have a brand, we didn't have an identity. So we, with our design partner IDEO.org, they developed this national survey, which our youth advisors took first, and then we shared it across the nation. And the main question was, how did you want to feel when you walked into the center? What did it have to do for you? Let me know how it is for you to feel welcomed. And so through all those questions, these were our 6 insights that we gathered. And the one that I like to share is number 3, seeking professional care requires a leap over a huge abyss. One of our core development design elements is this moment of pause, of being able to acknowledge the vulnerability that a young person, any person who is going to go into formal care, and being able to say, hey, my parents are cool, but I'm still talking, I'm thinking about this. You know, my friends are great, and I'm talking to them, but I'm still thinking about this. My teachers, my counselors, super cool people in my life, but I'm still thinking about this. So to be able to have a space where they don't really need to have words to be able to define how they're feeling, and it kind of just walks through that. The other point that I like to highlight is that engaging with mental health services often means stepping outside of your cultural influences. A lot of our young people come from different backgrounds, which is the strength of the diversity of this group. And they've told me mental health is something that's not regarded very positively. It's something that we don't talk about. I can't talk to my mom about this because we don't have conversations like this. And so being able to provide a center that is meeting those needs, while at the same time with our family support, bringing families together to be able to encourage that conversation. And number 9, everyone is trying to solve young people's problems, but no one is truly listening. And this really was the motivating factor, I think, with all of youth mental health integrated care from Foundry to Headspace. So we needed to have young people at the table with us making those kind of decisions. And so today I'm going to invite you to listen to some of our young people. All right. So I'll hand it over to Vicki.
Thank you, Anna. So before we hear from Kwa and Julia, can you share a little bit more, Anna, on how young people are engaged in the model for development and implementation?
Sure. Oh, mira. The youth handed me the mic. I love this. Is it working? I don't know. Hello? Can you guys hear me? All right, cool. So these youth principles that we have up here were developed with our young people, with our first youth advisory group. And we're thinking, like, how do we really support this goal of true leadership development? So those first 3, and I can't see them because I'm at an angle. Can I just borrow your mic over here? Sorry. There you go. So the first 3, youth involvement, youth expertise, and youth direction, really talk to the crux of why young people are with us. Their feedback is expert feedback. Their youth experience, it is what drives all of those questions of how do we really integrate their needs and their solutions into a model for their community. The other 3, learning, leadership, and collaboration, really talk about the dual accountability. I've been working with young people for the last 23 years. And the one thing that I've seen is no one likes being told what to do. And so for us, it's like there's a dual accountability there. As a staff ally, my job is to make sure that they have opportunities for learning, co-leadership, co-collaboration, so both of us have this accountability to each other. So we're both, all of us working together, and we're creating spaces where their skills and advocacy really come up. And then shared decision-making for how we work with at allcove is really about the transparency involved in making decisions. So not asking questions that are so big that there's nothing that we can do about it, but being able to have conversations, discussions, being able to talk to them about policy, being able to talk to them about funding, being able to engage them in those kind of conversations so that they're able to make a true decision when it comes to their center. And so these core principles, again, were developed with our youth advisors, and what we're modeling not only with our Center Alcove team youth advisors, which Julia and Kwa are both part of, but also all of the advisory groups all over the state. Thanks.
Thank you. So I would love to hear from each of you. If you want to just share a little bit about how you got involved and what impact Alcove and the youth advisory groups have had on you.
Hi, everyone. Is this working? Okay, thank you. So my name is Kwa Nathan Ngo, but that is a mouthful, so feel free to just call me Nathan. And how I got involved with Alcove, I guess I should start with that first. Like many youth, my interactions with the system have been uncomfortable, and that is sort of an understatement. I grew up in a pretty abusive and violent home, and I didn't know who to turn to. So my sister and I, we filed an anonymous report with the police. And when the police came to our home, they knocked on the door and said to my parents, "Your children have filed an anonymous report against you." So that's kind of the beginning of some uncomfortable interactions with the system. After that, I was referred to Child Protective Services, which also broke my sister's and I's trust. I remember going to a mental health specialist too, and I was told that the meeting would be confidential, but when we were conducting our session, the therapist was texting my mom about what to talk to me about, what things she was hearing, and I was told that it'd be confidential. And one way you can get a complaint like that heard is if you enter into a lawsuit, and a high schooler doesn't exactly have the money or wherewithal to do that. So after so many uncomfortable run-ins with the system, I felt kind of disillusioned. And problems are systemic. There were other children, other youth in my community who needed help like that. But when they asked me whether they should go to a therapist or talk to legal services or even talk to their teacher, to say no, don't do that was heartbreaking because who else could we turn to? And that wasn't right. So to be able to be part of Alcove now, to create a space where youth can find help and support, that's everything a younger me would have wanted. It's everything a younger me would have needed. So that's why I'm here. Alcove, after all of those uncomfortable runs of the system, gave me mental health support that built back my trust in the system, and that's why I'm here.
I think for me, Alcove represents a lot of hope. I lost my younger brother to suicide when he was 13 years old and I was 15. So now I'm 21 and I've pretty much been a mental health advocate ever since. And I think joining the youth advisory group with Alcove has given me a place to put my grief and a place to talk about the issues that have been a struggle for me and my family, my younger sister and I, and been able to be a place where I feel like young people are really heard and understood and are able to create a space that is designed by and for them. And I think that's a really important part of what Alcove is.
We talk a lot about how youth inclusion, shared decision-making, and youth-led development are cornerstones of the model. So can you talk about some of the opportunities that you both have had in providing feedback and supporting the development of the model?
Ooh. So when Alcove says that it truly involves its youth, that is no exaggeration. When we've hired clinicians, when we've hired staff, I have been part of those meetings as part of the hiring committee, and I have seen my feedback and the feedback of my fellow youth truly be taken into account of whether or not we should hire this person. Does this person know how to interact with youth? And it's not even just big ticket items like that. The design of our couches, the color of our cushions, those have all been run through by youth. And those are actually some of the more fun sessions we have. It's also being sitting here right now, being part of the YAG has given me the opportunity to talk about my story, to represent communities that typically aren't represented. Most kids like me end up pretty invisible, but I'm sitting here with you right now, and that's pretty incredible.
I would echo all of that. I've had a lot of fun looking at bike racks to get to the Alcove in Palo Alto. I ride my bike around Palo Alto, and I think just as was already mentioned, having the opportunity to be in on hiring, also on staff descriptions before hiring even occurs, evaluation committees. So I've sat in and, how are we going to evaluate allcove? What questions should youth be asked when they're intake into an allcove? What should their experience be like from the second they walk into the door to when they need follow-up services? What will that look like? Those have all been ran through the YAG, which doesn't just include the two of us, but tries to really encompass different communities and different representation within our communities to ensure that allcove is a safe space for all.
And we've had the honor of working with you for a few years now, so can you share what has kept you engaged so that others who work with youth know what works to keep youth engaged in projects like this?
I think seeing meaningful change and being able to come to events like this and get out in the community. I've been able to speak at high school suicide prevention events. I've been able to see the impact of what I'm doing on the Youth Advisory Board as being foundational in how alcoves are designed and are ran. And so I think that's kept me really wanting to be engaged with alcove, because I can really see how my voice, which has evolved from being a high school student to being a college student, moving from Southern California to Northern California, I represent those backgrounds and communities and understanding the distinct needs of people in those age groups, as alcove is from 12 to 25. I think it's really important that youth are involved at all of the different stages of alcove.
Definitely echoing all of that. I think what keeps me a part of allcove, and I think what keeps so many of our YAG members a part of allcove, is that many of you guys come from public service backgrounds, education, health, and I think we can all agree there's a lot of talk and not a lot of action, and that can wear down on you. But with allcove, to see my experiences and insight and initiative being turned into real change, to see youth benefit from that, it's the way it should be. And to know that I am making a meaningful difference, as trite and unoriginal as that is, really, really does keep me around. It's nice to see that I can be the change I want to see in the world, which, by the way, yes, is every generic quote on a pillow.
And so when you think about all of the people in the room and what you would love for them to know about youth well-being and the needs that you're seeing, what would you like to share?
That's not a complicated question whatsoever. To have the chance to be able to talk to all of you and have your ear is something that I value a lot. So thank you, everyone, for taking the time to come here and be in this room with us. And if there's one thing that I would want you guys to take away just from this panel, is that it's so important to listen to youth experiences. It's so important to be guided by your own experiences, but also look around the room and see who isn't there. Look around the room and see what experiences aren't represented. And that's the main challenge. You need people at the table you have no idea how to reach. And you need to constantly look beyond and outside yourself. But as long as you are aware of that and that guides the work you do, will be able to bring people who shouldn't be here at the table. And I mean that literally as well. I should not be at this table, but somehow I am here. So thank you.
Got to be able to do that.
I would just echo that listening to youth comes with listening to all youth, and that can be difficult to find all those diverse perspectives. But I know when I sit in on our alcove meetings and I'm surrounded by other youth who have completely different thoughts that I had never even thought of, and to be able to hear from their diverse perspectives and the things that might keep them from going into an alcove, something that might make their experience different from mine, I think really influences how we're able to bring alcoves to different communities and make them look and feel just a little bit more tailored to that distinct community to make sure that youth needs are being met.
And for those that might be considering whether alcove would work in their community, is there anything that you would want to share with them about what to consider or the impact?
I definitely think talking to youth is important. So I know for some of the alcoves that have come about, they've looked at a community needs finding survey and looked at, would youth want something like an alcove in their area, and guiding those questions by youth to begin with from the very start to make sure that they understand kind of what the needs already are, but how we can make sure that we're reaching everybody and seeing how something like this could fit into the community.
In terms of making allcove work for your community, I want you all to know that allcove isn't one static model. The reason that the youth advisory group is such a key part of every single allcove is that the youth reflect their communities and allcove reflects the youth advisory group. So if you come from a place where mental health isn't accepted, if you come from a place where these one-size-fits-all models don't work, that's the beauty of allcove. It's meant to reflect you. It's meant to reflect your communities. And it's like a mirror in that way. So if you are thinking about opening up an allcove in your community, I highly suggest doing so. But before you start, I would say make sure that the youth advisory group that will be at the center of your work is reflective of the community it's part of. That's the first step.
So I was trying to leave a couple minutes for questions if we could. I just wanted to let folks know, as Steve mentioned, that there is going to be an RFP coming out, so we're hoping that there will be some funding available. And please get in touch with us if you would like to learn more, and we'll also be here for questions. And I think we have a chance for a couple of questions for our panel, if anyone has any.
I was wondering how you handle parental permission.
I can speak a little bit about what I do know, not as a clinician.
Sure.
The question was, what do you do about parental consent or permission? So I do know that in the state of California, you can access mental health services at the age of 12 without parental consent or consent of a guardian. And so one of the things about allcove is that it is designed to be low to no cost. And so with that, youth can access services without having to worry about how they might have to tell their parents. Although if you do eventually realize that when you're receiving services, having parents in the picture is something that you are able to do or would be willing to do, you can work hand in hand with your allcove provider to help you figure out navigating those conversations.
Great. I think we have time for one more question. Anybody?
Hi, I'm a child psychiatrist up in Northern California, and I have worked a little bit with youth groups, and I have tried to figure out how to connect them to the schools to kind of help access to kids for tertiary care or for assessments or for more care than they're getting at the school. And I was wondering, how do you deal with HIPAA? You know, let's say if you have a youth counselor who's on the school who's younger than 18 and they know about what's going on with their friend. How do you work that? Is there an issue around that?
Steve is.
Or do you just not worry about
Steve
it?
is well versed in HIPAA and FERPA issues.
Where'd Dr. Joshi go? He's over there. So Shashankar, I'd be glad to talk with you about that question in relation to the school-related pieces. But within the context of the allcove centers, really all of the services are sort of HIPAA-related services as opposed to the whole HIPAA-FERPA question that you see in school-based related services in terms of whether the provider works for the school district or whether they're a community provider working in a school. And I'm glad to talk with you further about that sort of specifically as well.
Thank you. Can we say thank you to our wonderful panel?